Good morning, everybody. My name is Rachel Crowther. I'm one of the matrons for theatres and daycase at ELHT. I've got two lovely colleagues with me this morning, Chris Emsley, who is our quality and safety lead, and I've got Christina Pickles, who is our robotic clinical lead. Okay, so let's start. Through innovation and foresight, ELHT are we currently have two robots within the trust. The original robot was secured in 2015 with the first robot within the East Lancashire footprint, and we undertook predominantly prostatectomy surgery. The expansion to maxillofacial and colorectal surgery quickly followed at the acute site at Blackburn. Following the success of the first robot, investment into a second robot was made in 2020, which enabled expansion of the robotic service into gynecology on the elective site. The Da Vinci robots are displayed here, and two of our robotic colorectal surgeons, Mr. Shake and Mr. Gill, to the top left, and the bottom right screen is Mr. Willett, one of our robotic gynecology consultants. Our surgeries incorporate 4 specialities across 2 hospital sites. Next slide, please. As previously stated, ELHT have been undertaking robotic radical prostatectomy surgery for the people of East Lancs and South Cumbria. The innovation and foresight was led by the urology department within ELHT, and in particular the clinical director who drove the project forward to commission the installation of the Da Vinci robots. The first procedure took place on the 1st of June 2015, and the trust has been carrying out robotic procedures on a weekly basis since. From this day, our robotic programme has flourished. So knowing that the investment would improve the quality and delivery of patient care, the founding members dedicated to drive this initiative needed to be more risk avert. The drive to secure the commitment from both the external and internal stakeholders, as well as the trust board and community, was achieved wholeheartedly following multiple discussions around the vision. As an organisation, the quality and delivery of patient care is paramount to us all. Our initiative is innovative, demonstrating the hard work, dedication and commitment required by a team of professional people. Support also came from our charitable funds, clinical commissioning groups, surgical division, theatre team management, the clinical teams, and they are all responsible for making this robotic programme a great success. Next slide, please. As most of you will know, this precision approach optimises patient outcomes. Following the surgery, the patient will have a shorter stay in hospital, reduced risk of infection as the surgery is less invasive, and ultimately they're able to return to normal activities quicker. With the service, it has expanded across specialities, and this technology is now available to more patients in need of this specialised clinical technique. This innovation facilitated the engagement of forefronting technology, and as this surgical tool allows doctors to go way beyond the limitations of laparoscopic and open surgical procedures, enabling the clinicians to see high resolution and 3-dimensional imaging. This unique experience for all our robotic patients improves cancer outcomes, as it gives the surgeon the opportunity to remove part of the anatomy with a high degree of precision. Next page. So training. ELHT at the forefront of robotic surgery and recognise the need to continue investment in the technology and the staff to ensure our patients benefit from this approach while providing safe and effective care. To this end, ELHT have recently invested in a nurse clinical robotic lead to support the staff and be instrumental in the growth of the service. A training programme is now embedded to ensure a positive culture in fostering an environment where staff development can be promoted and subsequently flourish. Education. Some would assume this goes hand in hand with training. However, education for ELHT is also about awareness, ensuring our community are aware of the technology available to them to give them the best possible outcome following elective surgery. From the beginning of the relationship between ELHT and Intuitive, it has been an excellent, and it has accomplished upskilling of consultants and the robotic interest. In addition, Intuitive have approached one of our consultants with regards to being a proctor, supporting the training of surgeons at other trusts. We remain focused and deliver in-house training, webinar updates, and access to online modules and simulation training. Next slide, please. So let's talk about our performance. ELHT have been fortunate to have within our consultant body a dynamic individual who specialises in head and neck surgery, who through their passion for robotic surgery delivered a course which was accredited by the Royal College of Surgeons. The study day welcomed a faculty of head and neck consultants to share their depth of knowledge and experience. Patients were also invited to present their individual stories and experiences. It was such a positive day for professionals and patients alike. Patients continue to support us, attending open days and training events to talk through the impact that this innovation has had on them. We currently perform over 650 robotic cases annually. The expectation is that this will increase substantially over the coming years as the Trust invests in the training of staff, consultants and our scrub staff, opening up robotic surgery to other specialities and doing other procedures. With this in mind, the investment in the clinical robotic lead to ensure continuity of this training is delivered and ensure safe environment for all our patients is absolutely essential. Next slide, please. The development of our first assistant programme. We have a number of qualified robotic surgical first assistants. The Trust is working towards strengthening the robotic team to ensure and secure the future of this innovation and surgical technique within ELHT. To this end, the investment in surgical first assistants and robotically trained consultants is high on our agenda, and we hope it will lead to a greater number of patients being offered minimal invasive surgery. Next slide, please. Okay, so our second robot was secured and installed at the start of the pandemic, a real challenging time. The vision for the gynecology and more robotic procedures was carried out on our elective site at Burnley. This vision would protect patients from the pressures of the acute site at Blackburn. The gynecology surgeons carried out their first robotic case in February, and this was recognised in the House of Commons. We received positive feedback from the Health Secretary commending the Trust's innovation and determination to continue with life-saving surgery whilst facing the relentless challenges of COVID. Our achievements. The Trust continues to excel in robotic surgery, and through our pioneering team have performed joint operations removing pelvic cancer and repairing complex hernias. The patient's quality of life following this has been significantly enhanced, and this was published in a paper early in the year by ELHT colorectal robotic surgeons. Next slide, please. This slide really speaks for itself. It's about patient experience, and honestly, it's been nothing but positive. And these are just a few of the comments. ELHT are proud. We're really proud of our robotic surgery and what it offers our patients. It not only gives them hope in these challenging times, but it gives them quality of life. Next slide, please. So ELHT, a recognised specialist centre for HPB surgery, and the desire to continue these procedures robotically is from one of our surgeons has been sanctioned. This has now been reignited following the avoidable delays due to the pandemic. As mentioned previously, one of our consultants has been approached regarding being a proctor, which will enrich ELHT and ultimately enable the development and teaching of surgeons in-house and also across the network. This will result in ELHT being deservedly the Robot Centre of Excellence. Due to the strong leadership within ELHT and innovative surgeons, the Trust continues to support the service and its development. The staff and people within our community recognise the benefits of robotic surgery, and through ELHT and Me, our official charity, funds are raised through events that are organised. This not only brings the community together, but it also celebrates the success and ultimately promotes choice to our patients. Thank you so much for listening.